Hey, welcome back everybody. This is the last part number 3 on Oral Minoxidil Series, where I'm going to be sharing Dr. Pathomvanich 20-year experience with prescribing oral minoxidil, since it's really hard nowadays to find a reliable physician who is not only able to prescribe oral minoxidil for hair loss, but also has plenty of experience in this field, and that's Dr. Pathomvanich. At the end of this video, we'll be also looking at one impressive result of a Norwood 6 with diffusely thinning temples, sides, and humps, who was put on oral minoxidil and only got like 1,600 grafts additionally transplanted for a really nice cosmetic improvement overall. Let's start. Welcome back everybody, my name is Matt and you're watching my hair loss and hair transplant related channel. So if you are new and you are interested in a hair transplant, then make sure you download my free ebook 5 Things I Wished I Had Known Before My Hair Transplant, which can tremendously help you for the start. Now let's talk about Dr. Pathomvanich and his experience with oral minoxidil as a physician, why he decided to use it in his practice despite being against it initially. He's a member of ISHRS, AAHRS, and he also used to be a member of American Board of Hair Restoration Surgery. He contributed to many hair transplant textbooks with his insights, especially on oral minoxidil, like hair restoration surgery in Asians. In this forum post, he stated that he was entirely against taking oral minoxidil 20 years ago when he started his private practice, since it wasn't and still isn't approved by the FDA. So instead of that, he encouraged patients to use minoxidil lotion only in fear of the side effects from oral minoxidil. After many years of practice, however, he has realized the remarkable effect on hair growth from oral minoxidil compared to the lotion. He prescribed oral minoxidil for hair loss treatment in less than 1% of his patients over the past 20 years. Interestingly, he also stated that whether oral minoxidil has been used alone or in conjunction with oral finasteride did not really make a difference in terms of results. So that's quite interesting, and I'd like to hear more on that, of course. He said he used oral minoxidil with caution, since there weren't and still are not many studies on oral minoxidil's efficacy and safety in androgenic alopecia. Now, to me, his approach towards prescribing oral minoxidil seems to be pretty ethical. He has always counseled his patients on potential risks and side effects, and each patient had to take the risk himself. He also never prescribed oral minoxidil to patients who are known to have like cardiovascular diseases, history of like deranged blood pressure, and or liver and kidney dysfunction, okay? So that would be quite risky to do. Since there is no standardized dosage of oral minoxidil for treating hair loss, the physicians still have to experiment and closely monitor their patients to find out the optimal dosage of oral minoxidil, which is the most side effect free but also efficacious enough. This is what Dr. Pathomvanich did as well. Well, he said he learned from other physicians who have also prescribed minoxidil extensively to treat androgenic alopecia, and was informed that 5 milligrams per day was enough to stimulate the hair growth without any effects on blood pressure and heart rate, which has been also shown in some of the studies I presented in the episode number 1, number 2 on oral minoxidil. Based on these studies, the efficacious and also side effect free dose of oral minoxidil has been shown anywhere between 2.5 and 5 milligram for men and up to 1 to 1.25 milligrams for women. He has been prescribing 5 milligrams of oral minoxidil daily in his practice for years, and in some cases where patients were taking between 2.5 and 5 milligrams of oral minoxidil every other day, they still reported significant hair regrowth and stopped the hair loss to his satisfaction. Now, it's important to point out that some patients may respond only in the crown but not at the front, and also Dr. Pathomvanich said that he had patients who did not respond at all, but just got hypertrichosis, which is the excessive body hair growth anywhere on the body besides the scalp, okay? His experience also states that oral minoxidil should not be used by women, as the hypertrichosis may persist even after oral minoxidil is discontinued. I don't know whether he did or did not prescribe oral minoxidil to women, but for example, this study shows that even if women take oral minoxidil and use spironolactone simultaneously, the excessive excessive body hair growth can be minimized that way. Women who are breastfeeding should not use oral minoxidil, as the minoxidil can pass onto the child that way. Interestingly, for some patients, Dr. Pathomvanich advised to switch back to minoxidil lotion after making some hair gains with oral minoxidil, just to see whether these hair gains could be maintained with the topical minoxidil. Now, by some patients it was possible, and by non-responders to topical minoxidil, the hair which had been gained by oral minoxidil just shed within the 3 to 4 months after either stopping with oral minoxidil or after switching back to the minoxidil lotion. Alright guys, now let's take a look at the example which I was talking about at the beginning of the video. This patient is one of the patients of Dr. Pathomvanich. He was put on oral minoxidil, and we don't know whether it was 2.5 or 5 milligrams. We don't know whether he was taking it every day or every other day, but we know he has been using oral minoxidil, and he also got a small hair transplant. So let's take a look at his result. This case has been also documented in the book Hair Restoration Surgery in Asians. This patient had diffusely thinning temples, sides, and also the humps above the parietal hairline, okay? Starting with oral minoxidil not only regrew his hair on sides and temples and the top of his scalp, but also made him a better hair transplant candidate that way, because his donor hair reserves on the sides could be now used as well, as long as he would be taking oral minoxidil, of course. Now, on the after result, it is obvious that most of the implanted hair has been distributed around the frontal third, and some of it also on the mid-scalp and crown. I assume that the best hair regrowth from oral minoxidil could have been observed on the crown by this patient and not as much on the front, if we take a look at the before picture. Next to the sides and temples, which had like an amazing hair thickening thanks to oral minoxidil. This patient will most likely have to take oral minoxidil for his whole life if he doesn't want to lose what he gained from oral minoxidil. Even the transplanted hair, which had been extracted from a region on the occipital area previously thinning but now thickened up with oral minoxidil, would very likely thin again after hair transplantation once the patient stops using oral minoxidil or any other treatment that improved the thickness of such hair initially. Alright guys, that was it from me. This was the third episode on the Oral Minoxidil series on this channel, and as soon as there will be like new research on oral minoxidil, I'm gonna update this playlist with new episodes. So thank you so much for watching, everybody, and see you in another video. Cheers.